Next little bit of data is taken from the Commonwealth Fund. The Commonwealth Fund was founded in 1918 by a woman philanthropist whose desire was to create a body of intellectuals that would analyze healthcare in our country and for quality, for efficiency, access, equity, and healthy lives. So we're going to go through each one of those pretty quickly, but stay tuned. So quality, we do about as well in one segment of quality than others, or about the same as. The U.S. fares best on provision and receipt of preventive and patient-centered care. We don't do very well when it comes to safe and coordinated care. So as you'll see on another slide as we go along, we lead the developed country in lab errors, medication errors, and the like. This graph shows you that hospital admissions for preventable diseases are more frequent in the U.S. than in comparable countries. So for things like congestive heart failure, asthma, hypertension, and diabetes, we lead the group in hospital admissions for preventive conditions. Efficiency. The U.S. has poor performance on measures of national health care expenditures and administrative costs. 25% of our health care budget is allocated toward administration. So every dollar of health care that you spend, 25% of it goes to administration, as well as measures of administrative hassles, avoidable emergency room use, and duplicative medical testing. And here's the facts. U.S. emergency departments in place of irregular doctor visits is more common in the U.S. than other comparable countries. So there's the United States, clear up there at 13%. The comparable country average is 7%. And Germany, only 3% of the population use the emergency room for their usual source of care. This is not having a family doctor. This is not having one of me. It's not having a medical home and a place that you can rely on for your health care. One of the problems with that is that an emergency room visit is worth $2,200 on average. Coming to me is $140. Not cheap, but a heck of a lot better than $2,200. Access. People in the U.S. go without needed health care because of costs more often than people do in other countries, which is the argument for universal coverage. Here's the graph. Here's the data. Germany, if you live in Germany, you can get a same-day appointment 75% of the time. How many here can get a same-day appointment? Not very darn often. Can't in my clinic. I have people come in all the time and say, Jim, I can't get in to see. And then to get it within a week, we fail in both same-day as well as health care in a week. Equity. Equity is obvious what it is. It's about equality in care. U.S. ranks a clear last on measures of equity. Americans with below average incomes were much more likely than their counterpart in other countries to report not visiting a physician when sick, not getting a recommended test treatment or follow-up, or not filling a prescription or skipping doses when needed because of costs. This map is a 10-mile radius in an area in Pennsylvania. And what you can see here is that there's a great disparity between, in the left-hand side, life expectancy of 75 years, and the right-hand side, 82 years. And in the middle there at 69 and 70 are areas where people not only don't have access to care, but they don't have the social determinants of health. They have poverty, they have food insecurity, they have transportation difficulties, they have legal issues. All of the things that go together to modify how long you're going to live and how healthy you're going to live, how long you live. It's not okay. Healthy lives, this is kind of a cool measure. Healthy lives is all about attaining age 60 and then having a healthy life after age 60. So you might live to 67 or 69 or 72, but you may spend the majority of your time going to the doctor, in and out of the hospital, not feeling good, not being able to join your grandkids, not being able to relish the food you like because you're sick, you're nauseated. So what the hell is it good if after 60 you feel bad? So that's what this statistic is about. And the U.S. fails miserably in this dimension as well. So our senior population are more unhealthy than comparable countries, and this graph shows it. This is a compilation of all of those things, but if you look up at this one, the UK has the highest. UK? That's socialized medicine. Dirty, rotten scoundrels, socialized medicine. But they're number one. UK up at the top, Switzerland right after that, and right down at the bottom, the United States. I want you to focus right there at $8,500. This is a 2014 analysis by the Commonwealth Fund. This is the outcomes of all the 11 countries that they compared. The United States spent $8,500 per capita on health care. The UK, which came in first, spent $3,405 on health care per capita, and they're number one.